Thank you all for joining us today for this very important webinar on building mental health into emergency management and business continuity programs. We're focusing today on pandemic response. As we navigate through this COVID-19 pandemic and we begin to think about how to recover our operations and the economy, it is critical to think about how to build mental health into emergency management and business continuity programs. Experts are predicting that there will be a rise in mental health conditions following the pandemic, and we're not seeing the impacts of it yet. There's usually a delayed response. The idea of building mental health into these programs is that we can help to reduce the risk of developing mental health problems following the pandemic and help people to be able to manage through in a healthy and safe way as we get our business back in operation and as we move forward beyond the pandemic. You see, emergency response and business continuity programs typically focus on minimizing the risk and impact of physical injury, property damage, and any other economic impacts. When there's an outbreak of an infectious disease or a pandemic or an epidemic, your normal emergency management and infectious disease protocols, if you have one, need to be brought into place. But in a pandemic, the challenges are extraordinary, particularly if and when governments invoke emergency measures, as we've seen, emergency public health measures, to stop the spread of infection. The situation can change suddenly and rapidly, and your normal emergency management and business continuity programs may not be enough. So what we're looking at here is specifically how to build mental health into those. So here's what we're going to cover. We're going to look at the potential impact of emergencies and disasters, COVID-19 in particular, on the mental health of workers. We're going to talk about worker mental health needs and what that looks like in dealing with emergencies and disasters, including infectious disease pandemics. And we're going to talk about how to use the National Standard of Canada on psychological health and safety in the workplace to build mental health into your programs. So let's start with a bit of information about the way that the brain functions. When we are in a normal situation, dealing with normal stresses of life, we're usually able to think fairly clearly. We're able to access those higher functions of the brain that you see in the prefrontal cortex, which is the red section there labeled as the frontal lobe. This is where we find the actions of things like speaking, thinking, reasoning, and problem solving. When we are under increased stress, then there may be a threat or danger being perceived by the brain, and something called the amygdala, which is buried deep within the brain. You can't see it on this diagram, but it is deep within the brain. The amygdala turns on, and the amygdala's job is to protect us from that threat or danger. When the amygdala turns on, that's where we have the fight or flight response. So what it's doing is it is signaling to the body to start releasing stress hormones, what we typically call stress hormones. Things like cortisol, progesterone, testosterone, epinephrine, dopamine. And what these hormones do is that they are intended to help to give us that boost of energy that we need to either fight, flee, or hide. Now, when we are dealing with a situation of emergency or disaster, obviously there is a heightened feeling of fear, there's a heightened feeling of threat or danger, and the amygdala is firing. And what happens when the amygdala is firing is that some of those higher functions of the brain tend to shut down as the amygdala takes over. So thinking, speaking, reasoning, problem solving all become a little more difficult as we're trying to figure out how do I get out of this situation. Other aspects of the brain may also be affected, those that are in the temporal lobe, for example, where memories, hearing, behavior, and generating emotions are seated. And the longer we're experiencing the stress, the more impact it's having on these functions of the brain. Now, I'm not saying that all stress is bad. We know that as human beings, we operate fairly well under pressure, but there's an area of peak performance. And this is what we want to try and help people with as we're going through emergencies or disasters. In any situation, this area of peak performance is where we feel the most energetic. We may even feel tired after putting in a good day of work or a good shift of work, but we shouldn't be so exhausted that we're not able to do anything else in our life. This peak performance is not just a work thing. What we're looking at is peak performance in any area of our life. So it's both work-related and personal, because we are whole human beings. We can't separate ourselves between our work self and our home self and the person we are with our family or the person we are with our friends. We are one human being. So we need to make sure that we have the energy that we're able to have in order to do the work, in order to have the relationships, in order to do the things that we want to do in life. So helping our employees to be able to maintain that energy at peak performance is extremely important. And as we experience increased stress or increased pressure, we may start to move into the areas that you see here, which are indicators of stress and overpressure. And you'll start to see indicators like indecisiveness or fuzzy-mindedness, really feeling exhausted all the time, just not being able to get that energy back. Being irritable without being able to kind of understand even why you're being irritable. And I can attest to this personally. I've been through burnout myself. I know that when this happened with me, I was at a point where I was exhausted all the time and I was feeling irritable and I couldn't even explain what was going on. I couldn't figure out why I was being irritable. I didn't want to be irritable, but I was. And then the anxiousness set in. And that anxiousness just felt like the world was going to fall out from under me. I couldn't figure out why, and there was nothing I could do about it. And at that point, when a person is at that area of their life, it's very difficult to try and pull back because of what's going on. As I showed you in the previous, the amygdala is taking over, those hormones are running around, and when a person is under chronic stress, they're not able to get rid of those hormones, because we get rid of those hormones through sleep and rest and rejuvenation. So in a situation of chronic stress, the risk of burnout becomes very, very real. And so the whole purpose of building mental health into your emergency management and pandemic response programs is to help to reduce the risk of chronic stress and help people to be able to operate in peak performance. So I'd like you to take a moment and think about what the benefits are of building mental health into your own emergency management and business continuity programs. If you downloaded the worksheet that goes along with this video, then take a few moments and just jot down what those benefits would be. Usually we hear things like people will be able to focus more. People will be able to solve problems. They'll be able to be creative. They will, the organization will not experience as much absenteeism. There will be less conflict in the workplace. These are some of the things that we tend to hear when people start thinking about building mental health in. So I want to talk a little bit about the effect of emergencies and disasters. We can take some of our learning from some of the studies that have been done. There are limited studies on the effects on mental health. The one that you see on the slide here is one of them. This report on protecting the psychological well-being of staff exposed to disaster or emergency at work. This is a qualitative study that was done. And what came out of this study was very interesting. They showed that there's both positive effects as well as negative effects. The positive effects, you know, when people come together and deal with an emergency or disaster well, what we see is there is an increase in morale, a real boost in the way that people feel about how they got through it. there's also a new appreciation for life. I mean, definitely when we're dealing with a pandemic, especially this pandemic, we're seeing that there are a lot of people who are really struggling, suffering. There's people who have passed away. And this really does bring in a new appreciation for life. We also see greater maturity, greater emotional maturity as people work through problems and work through the struggle together. And there's greater compassion and sympathy and understanding for people who are in difficult circumstances. And we're seeing that all over social media and all over the news as people are coming together and helping each other out. And this is really where, you just see an explosion of the human spirit. And it's wonderful to see these positive effects. So I don't want you to lose sight of the fact that not all of the effects are negative. And if we can try and focus on what those positive effects are, that can be really helpful. But we can't ignore the fact that there are negative effects. When we go through emergencies and disasters, we tend to feel a sense of shock. And certainly going through the COVID-19 pandemic and the whole economy shutting down, that was, there was the shock of the pandemic itself, and then there's the shock of the economy shutting down. So it's a bit of a double whammy there. People tend to feel helpless. There's worry, there's guilt, there's fear, there's fatigue and exhaustion. And depending on how the pandemic, how the emergency or disaster has affected you in your own personal life, these feelings may be amplified, or you may not be feeling them as much as some other people. Certainly, if you have someone at home that you're a caretaker for, there can be increased distress, whether this is a person who is maybe a spouse or a partner or a child or a parent or someone else in the home who needs your care, or perhaps they're outside of the home and you need to go and care for them there. The studies show that there's an increased distress in caretakers. Post-traumatic stress disorder, depression and anxiety, these are all very common after disasters and emergencies. And in fact, the studies have shown that workers who have routine exposure to trauma, such as rescue workers, police, firefighters, body handlers, these all have increased rates of PTSD, depression, and anxiety, as well as other mental health problems. But the studies are also showing that workers who are not routinely exposed to trauma are showing higher rates of distress and mental health problems after an emergency or disaster, and that the results of that are similar to those shown by rescue workers. So this is a concern for all workers, not just people who are kind of frontline. And then there's the vicarious and secondary traumas. Now, vicarious trauma usually happens when a person is exposed to hearing, seeing, or reading an account of a disaster, a traumatic situation from another person. So things that we see on the news, things that we see in social media, or someone that we know personally talking or debriefing or venting about what has happened and what they've experienced can actually cause secondary or vicarious trauma to the person who is receiving that. And we see that a lot in certain industries where a person is having to be exposed to that. But it's also an issue for someone who may already be experiencing a mental illness, that they may already have heightened anxiety around those issues and may experience vicarious trauma around that as well. And then secondary trauma, this is also a risk where something in the emergency or disaster, or even afterwards, triggers a past trauma and then ends up bringing it to the surface again. So these are all things that we need to be aware of, that people might be struggling with as we're going through this response to COVID-19, and as we're trying to get our economy back up and running, as we're trying to get people back into the workplace or try and move forward into our new normal, is that these are the things that people may be dealing with. And the great thing, though, is that the research also shows that good organizational leadership and a supportive work environment can have a positive impact on the well-being of staff members prior to, during, and subsequent to the event. So there's certain things that are good to have in place, and we're going to talk about these things and see kind of, even if you haven't got them in place yet, putting these things in place will help your workers move through this in a healthy and safe response. So what is the purpose of a pandemic response plan? Well, the goals are to protect the health and safety of workers and other people, and to ensure business continuity. And the objectives: first, you want to minimize the risk and potential impact of infection of the infectious substance, so in this case, COVID-19, on workers and on any customers, and the potential impact on the business as well. You want to support workers to perform essential work that is going to meet the stakeholders' needs in a healthy and safe manner. And notice we're always talking about the health and safety of workers, and there's a reason for that. When workers don't feel safe, when they don't feel that their safety is being protected, it will definitely affect their mental health as well. And it will have an impact on the ability for the organization to get back up and running in the most effective manner. We're also looking at minimizing the risk and potential impact of both physical and psychological harm that arises from the emergency measures that are taken. So, as we've said, with the emergency measures, much of the economy's been shut down. That is also having an impact on workers' mental health. So whether it's because of financial stress that's happening, whether it's because of isolation, whether it's because of not being able to visit with friends or family, being at home alone, or being at home dealing with all of the other multiple roles that people are having to deal with, this needs to be part of the objective of the pandemic response plan. Ensuring a healthy and safe return to normal working conditions following the pandemic. And, based on what we're seeing, the return to normal working conditions it's going to be a new normal. It's probably not going to go back to the way things were before for many people. And looking at post-pandemic psychological support for workers and their dependents. And that is very important, because even when the actual pandemic is over, the mental health impacts from it can be ongoing. So we have to be aware of that, and we have to know what supports we need to offer in order to be able to protect our workers and their dependents as well. So let's look at the states of an emergency. For this, I have referred to the CSA standard Z1600-17, which is Emergency and Continuity Management Program. Now, there are many standards that you can refer to. There's going to be some that may be more sector specific or hazard specific, critical incident response. But for the purposes of this presentation, I'm referring to this standard because it is all about emergency and continuity management. So what this standard talks about are that there are 4 states of an emergency: prevention or mitigation, which is the first one. And this, at this stage, the intent is that the organization will develop strategies that focus on incident prevention and to mitigate, limit, or control the consequences, the extent, or the severity of the incident. Prevention strategies include things like activities, tasks, programs, and systems that are intended to prevent a threat or a hazard from occurring in the first place. And they are based on information that is obtained from risk assessment and from impact analysis. Now, the impact analysis usually includes information about the impact on operations, as well as the foundational elements of emergency management. It's one of the foundational elements of emergency management and business continuity programs. It looks at the potential impact, it looks at damage, it looks at loss over time. And what it's intended to do is help to figure out, well, what do we need to have in place if this particular thing happens? Most of the emergency management programs that I've seen do not have anything in there for pandemic. Sometimes they will have things in there for outbreak, of an infectious disease, but it's usually more on a smaller scale. So as we start to go forward and we think about our emergency management programs going forward, we need to think about building pandemic response into those emergency management programs. And as we move forward, I'll show you how to build mental health into that. The other stages that we're looking at here are the preparedness stage. So once you've gone through and done your risk assessment and figured out what the impact would be, then you figure out, what do we do to prepare for that? And in the preparedness stage, it's normally business as usual. Activities are ongoing. Nothing has changed yet. The emergency hasn't happened. Or in this case, the emergency has happened and you're preparing for the next one. But basically, it's business as usual. And what you're looking at here is developing, implementing, and maintaining systems that will support operations in the case of that emergency happening. So think about it in the case of a fire. You do your impact analysis, you put your fire protection in place, and you've got your hoses, and you've got your fire wardens, and you've got your fire drills and your plans and your training, and you're doing all of this while business is as usual, so that you're ready if something does happen. So it's the same with a pandemic response or any other type of disaster emergency. You put these things in place prior to it happening. Now, for the response and continuity stage, what we're looking at here is the emergency has happened, and you're activating those tasks, the activities, and the programs to help preserve life, to meet basic human needs, to preserve business operations, to protect property and environment. And you're also doing situational analysis at this time that needs to be done because the situation can continue to evolve and things can continue to change. So you always have to be looking back to say, okay, what's happening now and what changes do we need to make? What different parts of the program do we need to bring in? Is there anything that we've kind of missed that we need to put in here now? And then moving into the recovery stage, this is where you're doing the gradual or complete return to business operations. And this can include things like contractual obligations, looking at your core activities, making sure that employees and people within the neighboring community have the necessities that they need. Looking at how do you continue with your operations and how do you make sure that you are reducing risk continually as you are moving back into your return. You may have to look at environmental remediation and even process improvement. So this looks at, what are the policies and procedures that we have in place, and do we need to make any revisions to them? Now, as we start moving forward from this point, we're looking at response and continuity and recovery. And if there are things that should have been done in the prevention and preparedness stage that haven't been done, well, it's not too late to do that. Now is the time, because the things that you do now are going to help to be able to move forward. Some of the actions that are recommended in the prevention stage, this is again going back to the studies that I was talking about earlier. Employees reported that they had the greatest support, that they had the best response when they had that support from management. And some of the things that they said were so helpful were education and training on reducing stigma. So we know that when we're going through an emergency or disaster, when we're going through an infectious disease outbreak, there is this increased risk of experiencing mental health issues, as I've talked about. We also know that stigma is something that prevents people from reaching out for help until they are experiencing mental health problems to an extent that it's really interfering with their lives. In fact, about 64% of people who are experiencing mental health issues do not reach out for the help that they need until they are in a situation of feeling that they're not able to function. So helping to reduce stigma, helping people to understand that, you know, you may be experiencing certain reactions, you may be experiencing certain feelings and thoughts and concerns, and these are normal reactions. We are in an abnormal situation right now, and these are normal reactions, and helping to know where to reach out for help, creating those safe spaces. Now, one of the things that the studies showed is that training on recognition of signs and symptoms of mental illness was very important. Sometimes employees felt that they may know if a coworker is experiencing a mental health problem, but because of stigma, people can be very, very good at hiding what they're experiencing because they don't want to be seen as, they don't want to be labeled, they don't want to be treated differently. They may even feel that self-stigma themselves. And so training people on the signs and symptoms or the indicators of mental illness is so very important so that you can be aware of it, but also knowing what to do when you come across those things. What are the right things to say? How do we have these conversations? How can I help this person? It's not about being a therapist or a counselor, but it's about knowing those signs and symptoms and being able to help that person. Guidance on knowing where to go for support. And in fact, what the studies said was that not just guidance, it's not just about handing somebody a pamphlet and saying, you know, here's your EAP program, or have you heard about this offering out in the community? It's about really helping that person to be able to access that support if they need access. So encouraging them to letting them know about the support that's available, encouraging them to use it, and asking them if they need help to access it. Education about trauma and its effects, education about cumulative stress, these were also very important, again, for helping people to get past the stigma. And training for managers and supervisors on interpersonal skills and empathy. This was one of the ones that they said was extremely important, because when we are recovering from an emergency or disaster and we are trying to get business back to usual, there can be a heightened sense of urgency in everything. So helping to figure out, you know, how am I speaking? How are the things that I am saying coming across? How can I be more empathetic and understanding of what my employees or coworkers, or even myself as a manager or supervisor, might be going through, or my managers or supervisors? So it's all about those interpersonal skills and how we're actually communicating with one another. So these were all extremely important. And I just want to touch on one more thing when it comes to support. When the employees were reporting that that they were able to access programs out, whether it's EAP programs or programs out in the community, one of the things that they said was these programs were very, very helpful, but they're usually limited to maybe 4 or 6 sessions. The employer also has the opportunity to contact, if it's through benefits, you have the opportunity to contact your benefits provider and ask for an extension for that employee if it's helping them. And that goes a long way. And that is kind of intimately tied with the training for managers and supervisors on interpersonal skills and empathy, because the manager is going to be usually the one who is seeing what those signs and symptoms are, and hopefully interacting with that employee to see what their needs are going forward. So an organization that builds this into their program is going to have a better return, a better chance of business continuity, a better chance of having employees who are fully engaged than if you don't build these things in. Now, we've provided some some resources that can help you through this through the MHCC Resource Hub. And if you just type this in your computer, you will see it, MHCC COVID-19 Resource Hub. And there's a few different resources that are on there. For example, tips to talking to someone in crisis during COVID-19. This is a free resource. You can download it, and it's a 2-page resource. I would strongly recommend that you download this, go through it, maybe even practice it, because it will help you in the moment. There's some really good guidance on there. The self-care and resilience guides are also on there. They are free, and they provide some information about the mental health continuum, as well as some tips on how to care for yourself during this time that we're going through. There's crisis response virtual training for essential workers. If you're interested in that, that is free. That is for essential workers. And there's also some other courses, certainly mental health first aid and the working mind. These are courses that that Mental Health Commission offers. And we are currently working on getting those into a virtual format. So check back with the Mental Health Commission's website and on the status of these courses. And these are evidence-based courses that work together, they're complementary, and they help with overcoming that stigma and with understanding the signs and symptoms and the indicators and what to do when these things happen. There's also a lot of other organizations that are providing resources. So certainly have a look, check to see what's there, and utilize whatever resources you can that are going to be helpful for your organization. But definitely get familiar with them. So again, if you have downloaded if you're working from the worksheet, I've given you a list there to check off for resources that you have implemented, and certainly another one that if there are other resources that are not listed there, write down what the resources are that you would want to implement within your own organization, and make sure that that you're able to move forward with those. Now, what you see here is the mental health continuum that is included in the working mind. And the reason that I'm showing you this is that, we have to remember that everyone is on this continuum somewhere between healthy and ill. And when we're looking at the indicators and the signs and the symptoms of mental illness or declining mental illness, what we're looking for is trends, are a number of these things happening. Now, just because someone is having signs or symptoms doesn't mean that they have a mental illness. We are not doctors. We do not diagnose, but we do need to be aware that these things may be happening. And the idea is that we want to try and help people stay within the green area. Now, when someone is reacting, when someone is injured, or when someone is ill, now if they're ill in the red, then they're really at a level where it's very difficult to function. So they may not be able to work at that point, but they may be able to work with the right supports. And so really understanding this and knowing what to do when a person is experiencing those different levels of mental health or mental illness is extremely important, and it will help to be able to manage these things if they're manifesting in the workplace or outside of the workplace. But, like I said earlier, we are whole human beings. We bring our whole selves to work. We bring our whole selves home. There is no division there. So stress is cumulative. We have to recognize that when these things are happening in the workplace, we can't just turn a blind eye. We need to help people when they are in need of help, and we have to create those safe spaces for them to come forward and ask for that help. So again, as I've said, if you've got the handout, then please write down what other resources you find are helpful, And if you have resources that you're finding are helpful and you want to share them with other people, then please do that as well. So as we move into the recovery stage, what we're looking at, the business recovery stage, what we're looking at are strategies to restore business to an acceptable level. And so we really should be thinking about things like setting specific recovery targets, procedures, and processes for implementing the relevant activities that we need to have in place to bring business back up to where we need it to be. But there's other things that we need to consider as well. The needs of employees in their personal life. For example, as we are coming out of this, the lockdown, schools are still out. Daycares are not open in a lot of places. Now, there's differences between provinces and there's differences in different areas. But the needs of employees in your community and in your workplace are going to vary. So you really need to talk to them about what's going on in their life and what support they need in order to be able to meet their own obligations. And if you need them to come back to work or they need to come back to work, how are you going to support them in doing that? You may need to look at staggered return to work, where some employees are coming back and then other employees are coming back, and you may build it up, 20, 30, 40, 50, 60%, or you may need to rotate employees in order to bring it back to the level that you need it to be. You do need to ensure protective equipment is available for people, and we'll talk about that in a little while. Disinfection and transport of equipment being returned to the workplace if employees have taken certain equipment home, such as computers or chairs or other equipment, making sure that you're able to get that back into the workplace and that it is all disinfected is going to be very important. And following up with healthy debriefing methods. I'll talk about that a little bit later as well. And certainly as you're bringing business back in, you want to be looking at your policies and procedures to see what are the lessons learned and what changes do we need to make going forward. So these are all very, very important things to be thinking about. So let's have a look at the national standard now and how that can help. The National Standard of Canada on Psychological Health and Safety in the Workplace is a voluntary standard that provides a framework for establishing a system to manage psychological health and safety in the workplace. And although the standard is voluntary, it does provide some excellent guidance, and it can help you to deal with situations that would be considered critical events. In fact, there's a section in the standard that talks about critical events for organizations as well as critical events for individuals, and another section that talks about change management. But what I want to focus in on are the workplace factors. Now, we've all heard, well, not everybody has heard about it, but a lot of people have heard about the workplace factors that affect mental health of workers. And what we know is that when these workplace factors are in place well, it supports mental health. When they're not in place well, it can negatively impact mental health. So all of the workplace factors are interconnected. And the reason that we talk about the workplace factors here is this is what you would use to do the risk assessment with respect to the risk of mental harm for workers. These workplace factors, as I said, they're interrelated. When you make an improvement in one, you will see improvements in other areas. If one is suffering, then you will see other areas also suffering. What we're going to look at here are some of the ones that are very significant when it comes to building mental health into emergency management and business continuity programs. So the first one is clear leadership and expectations. And this is so very important because uncertainty is a major contributor to stress for most people. People need to know what is expected of them in certain situations, and they need to know how to meet those expectations. So one of the first things that you need to have in place is your communication plan. I mean, in your emergency response plan, you would typically have a requirement to implement your emergency response procedures. You would probably have a chain of command. If you don't have that already in there, then I would recommend defining that. What is the chain of command? Who has the authority for what decisions? And where do you go if you need certain decisions made? You want to build in a communication plan that communicates with all of your stakeholders, so your employees, you may have to communicate with vendors, you may have to communicate with suppliers, you may even have to communicate with customers, the government, and other stakeholders in the community. So build this all into your communication plan. But when you're dealing with your employees, there's some things that you really need to make sure are in there. Acknowledging fears, acknowledging feelings, acknowledging concerns, being transparent about the fact that we all are experiencing this is going to help people to be able to get over that stigma. Celebrate successes and reward and recognize. This is also very important because people are dealing with a lot. A lot of people are doing extra work, and recognizing everyone for the effort that they're putting in, not just the results, but the effort that they're putting in is going to go a long way in helping to build and maintain trust in leadership. Some of the other things you want to build into your communication plan: signs and symptoms of COVID-19 infection. Absolutely. People need to know, what should I be looking for and what should I be doing to, if there are signs or symptoms. Also, signs and symptoms of, as we talked about earlier, signs and symptoms of mental illness or declining mental health. You want to talk about health and safety measures. I'm going to talk about that in a moment. Communicate about the chain of command. Accommodation of high-risk workers. We'll talk about that in a moment as well. But it's one of the things that we don't tend to see too often in the communication plans, is how do we actually accommodate people who might be at a higher risk of injury, whether it's physical injury or mental injury. Yes, we do usually see things for how do we evacuate someone who is perhaps not fully able in a situation where we have to evacuate them from the workplace. But what about accommodation of people who are at high risk of mental injury during a pandemic, or at high risk of physical injury, or at a heightened risk of serious consequences if they do contract the virus? So we'll talk about that in a moment as well. You also want to include in there the expectation to comply with the law and guidelines. And the reason that you need to include that in there is that as an organization, there are responsibilities to comply with applicable laws. And so you want to include that in your leadership communications. Tell people where the resources are that they can access, and what the credible sources of information are. One of the other things that I want to really point out here is that you want to make sure that you've got the lines of communication open. People will need to express themselves. They will have questions, they will have concerns, and they will want to make sure that their voices are being heard. So have those lines of communication open. Let people know how they can get feedback back to the leadership of the organization. Let them know what will be done with that information. And if you don't have the answers to the questions right away, that's okay. Let them know that you will get the answers. You'll get back to them with it. That is part of building that trust and making sure that the communication is remaining open. So let's talk about the next one, protection of physical safety is one of the workplace factors in the National Standard for Psychological Health and Safety in the Workplace. And what it says is that protection of physical safety is present when a worker's psychological as well as physical safety is protected from hazards and risks related to the worker's physical environment. Now, this is very important. This was built into the standard because when workers do not feel physically protected, or when they don't feel protected from hazards in their physical environment, it can have a negative effect on mental health. Certainly, while we're going through emergencies and disasters, while we're going through this pandemic, as I said before, there's heightened fear, there's heightened stress, there's heightened anxiety in workers who can be exposed, whether it's exposure to COVID-19 or exposure to other hazards within the workplace. And because of the pandemic, because of the risk of infection, some of the other hazards also may be heightened. So as people are having to, as they're having to navigate through this and figure out, how am I going to do my work safely? There are things that you can do in your organization to help them with that sense of security in knowing that you're protecting their physical safety. And this is going to be top of mind for everyone as we go through this pandemic, because it is, in some areas there is more fear of contracting the virus, whereas in other areas people are not so fearful. Those areas haven't been impacted to the level that maybe some other areas have. In some cases, you may also be dealing with employees who have family members who may be at higher risk, or who may have contracted the virus, or they may have lost loved ones with respect to the virus. So making sure that they are physically protected is going to be of utmost importance. And this isn't just for your employees. If you have customers, let's say you're in retail, for example, or you have a restaurant, or you have any sort of a workplace where the public comes into, you have to protect the public as well. So not only are you having to protect your own workers, but you have to make sure that the people who are coming in, or who you want to come in, actually feel safe in doing that. And that will come across also in those communications that you put out. So let's have a look at what this means. When you're looking at protection of physical safety, you have to look at the level of risk that a person may be exposed to. So you want to put preventive measures in place, and the preventive measures have to match the level of risk and exposure. So if you're looking at the level of risk of COVID-19 infection, you may have different employees who are at different risk levels. You cannot just assume that because your workplace is, let's say it's just an office, I shouldn't say just an office, let's say your workers are working in an office and they don't have to go, there's no people from the public coming in, your workers are not having to go out for external meetings or anything like that. You may assume that everyone in that office has a low risk, but that may not be the case, because you also have to take into account the person, and the person themselves may be at a higher level of risk because they may have a low immunity, they may have other chronic conditions that increase their risk of contracting the virus. They may have other conditions that may increase their risk also of mental illness. And so you have to take these things into account. You may need to ask people to self-identify if they are at an increased risk. For example, someone who has a transplant, for example, has to take immunosuppressants, and they would be at an increased risk of catching an infection. Someone who has a respiratory condition may not be able to wear certain personal protective equipment. So they would be at a higher risk and may need different accommodations in the workplace or outside of the workplace. So you really have to understand what the level of risk is for particular employees, and then figure out, do I need to accommodate anyone who is at a higher risk? And we'll talk about that in a moment too. So you also have to remember that people do have the right to refuse unsafe work and refer to your occupational health and safety legislation on that. But managers and supervisors need to be aware of this and know what to do if an employee does refuse. There's also the issue around masks and respirators. There's been a lot of confusion around that. You want to make sure that people understand what the difference is between a mask and a respirator. And if you are having people wear respirators, you have to provide training and fit testing on those respirators to make sure that they are actually being protected by those. Now, in all of this, the key point is that you have to have an infection prevention and control protocol in place. This is going to be what's going to kind of govern all of those other things as you're bringing people back in the midst of a pandemic. If you don't already have an infection prevention and control protocol, then I would strongly recommend that you engage with someone who is qualified in this area. And there are certain things that you would want to have in this. So I'll give you just kind of a high overview of what you should have in there. So training on and education on recognizing the signs and symptoms of infection and the risk of being an asymptomatic carrier. I mean, we've all heard that you don't necessarily have to have signs and symptoms to be a carrier, to be spreading it around. So understanding what those risks are. What are the safe procedures that you have in place to prevent the spread of the virus? So things like safe greetings, procedures around coughing, sneezing, hand washing, reminders not to touch the face, screening procedures to protect workers from contact with potentially infected people, effective disinfection of environmental surfaces, and really understanding, what strength of disinfectant do you need? What are the correct use procedures? What personal protective equipment and ventilation requirements do you need? Make sure that you've got a current safety data sheet and follow the instructions. Making sure that you've got safe use, storage, and cleaning and disposal of any protective equipment that needs to be used. Safe use and storage and disposal of any of the other personal protective equipment. So it's not just the protective equipment for prevention of infection, but your workers may be needing to wear other protection, hearing protection, face protection. They may be wearing coveralls. They may be wearing protective footwear. They could be wearing fall protection. So how do you keep that safe and clean while we're going through this? Another one that people tend not to think about is first aid procedures. So you might want to look at updating your first aid procedures, because if you have someone in the workplace who is in need of first aid, but you don't have all the right equipment, or people don't know how to respond when you're dealing with somebody who may potentially be infected with COVID-19, well, you want to update those first aid procedures so that everyone in the workplace can feel safe and know that the procedures can be followed, and you've got the right equipment there to protect anyone giving first aid. And certainly, what are the procedures to follow if someone does have symptoms? How do you get help for that person? And what happens with the rest of the workplace? Do you have to shut down again? What are your cleaning protocols? What are your reporting protocols? These all have to be included. And then what are the specific protections you have in place for those who are involved in screening and who are involved in caregiving? And we'll also have to look at transportation requirements there as well. If you have to send someone to the hospital, for example, how do you get them there? Okay, so those are some of the things that you want to think about with respect to protection of physical safety. And it may sound a lot and it may sound overwhelming at first, but believe me, when you put these things in place, it will lower the stress levels of your employees because they will know that you're putting their safety first and that you're doing what you can to protect them. You may also have to look at some of the other things, like, are there still travel restrictions? How do we deal with that? If people are having to go on public transit, whether it's trains, buses, airplanes, taxis, whatever it is, how do we keep our employees feeling that they are safe? What are the requirements? Do we need to provide alternate forms of transportation? I mean, I'm hearing that a lot of people are very uncomfortable with taking public transit right now. How do we protect them when they are taking public transit? If it means that maybe you provide them with personal protective equipment to wear outside of the workplace so that they can get to and from work, you may need to do that. It may be something that will be helpful. So have a look at this. If you've got employees who are continuing to work at home, you'll also want to look at work at home guidelines. And you can check back to the MHCC site. We will be posting, or maybe by the time you've seen this video, we'll have already posted some temporary work at home ergonomic guidelines and safety checklists that you can use to help workers with getting through this time working at home. Now let's have a look at protection for high-risk workers. When you are considering high-risk workers, those who live with anxiety or mood disorders may need to have accommodation. And the accommodation can be in the workplace or perhaps outside of the workplace if they're working from home. You may need to adjust their workloads or their schedules. The main thing is that you want to have a discussion with that worker about what their needs are, about what their abilities are. Don't just assume that they're disabled. Most of the time people want to work and they want to feel that they're contributing, and certainly they want to have an income. So work with that person, and there are resources out there that can help you to work through that. So one of those resources, for example, is the supporting employee success tool that you can find on the Great West Life website for, can't remember the name of it off the top of my head, but I can provide the link for that if anyone is interested. Anyway, so yeah, have a look at what the accommodation needs of the employee are. Do they need adjustment to their workloads or schedules? As I mentioned before, you may want to look at expediting increased mental health support and treatment. Now, if you don't have an EAP program, if you don't have benefits, particularly for mental health supports and treatments, then you'll want to really, try and help that person be able to access mental health support and treatment that's available in the community. And I'll talk about one of them in a few minutes. Have some systematic check-ins and a buddy system, especially if that person is at home and especially if they are living alone. You want to be able to check in, ask some questions, how they're doing, watch for the signs and symptoms, those indicators. And sometimes a buddy system may work better than even having a manager check in, just because the person may feel more at ease talking with a buddy rather than talking with a manager or supervisor about what they may be experiencing. But definitely provide those check-ins, and then look for additional supports to help with any management of symptoms that they may be dealing with. So things like video counseling, access to other services that may be out there, meditation supports, headphones sometimes to block out ambient noise. So there's various things that you can do to actually help a person. And as I mentioned also, talk to people about whether they have increased risk of contracting an infection or increased risk of negative consequences, because you may also need to provide similar accommodations for those people as well. Now, looking at psychological and social support, this is another one of the workplace factors. And this is important because this is what's going to help the person to cope. So you want to look at how do we reduce the risk in the workplace, and also how do we help that person increase their resiliency and coping skills. And this is where psychological and social support comes in. So there's various things that you can do. You may have a self-care coordinator. Maybe it's through your industry association or trade association, or within your workplace itself, providing access to various mental health services. You might have a spiritual care counselor. I've heard of some hospitals that have spiritual care counselors that come in when really difficult circumstances occur and people really need that level of support. You may want to look at a peer support team. These are very, very successful. And if you don't already have a peer support team and you're thinking about putting one in place, have a look on the internet. There are organizations, very, very good organizations that provide training for peer support teams. This is very important because anyone who's on a peer support team is providing support to people who generally need to talk about what they're experiencing. And the people who are on the peer support team also need to know where the boundaries are and that they are not counselors, they're not therapists. They need to know what the right things to do are and how to protect themselves as well. Mental health first aid. If you have people who are already trained in mental health first aid, definitely, turn to them for support. If you don't already have people who are trained in mental health first aid, I would strongly suggest that you look into having people trained. Mental Health Commission has already trained over 500,000 Canadians in mental health first aid, and this is a program that is also it originated in Australia, and it's in numerous countries around the world. So very, very helpful, similar to physical first aid, but with mental health first aid, people will learn what the person may be experiencing when they're experiencing certain types of mental illness and what to do, how to help that person in a crisis situation. So it really helps. And then making sure, again, that managers and supervisors are trained in interpersonal communication and empathetic listening. Just being able to take that time and really hear what people are going through, what their struggles are, what their support needs are, and understanding that the way that we say things can really have an impact on people, and what to do if, if sometimes we've had situations where the urgency of what we're dealing with causes people to talk to each other in ways that may not be the best. And so this kind of training can help with preventing the fallout that happens in those kinds of situations, and also in repairing relationships when things have kind of gone the wrong way. Now, another one that you're going to have to be aware of, and this is extremely important when we're going through a pandemic, is that some people have contamination obsessions and cleaning and washing compulsions. And this can be heightened during a pandemic. And your emergency management program should include protection for these high-risk workers. So again, coming back to the protection of physical safety, helping that person understand how you're protecting them and providing personal protective equipment, providing training, and being aware of signs and symptoms is very important to protect that person and help them through this situation. Not only are they exposed to dermatitis on the skin, but they can also be exposed to chemical inhalation injuries, which can also put them at increased risk of complications should they contract COVID-19 or or other respiratory illnesses. So watch for this. And again, you may have to ask people to self-identify if there's a risk that this is a problem, and just, provide the support for them. Now, under psychological and social support as well, Wellness Together Canada is a new service to provide free mental health and substance use support. So you can go on the website there, sign up, and get help in different areas. And I would strongly suggest that you share this information with your employees, make it available, make it right up front, and encourage people to use it. Another thing that you'll want to do is really help people with transitions between stressful events. Depending on the type of work we're doing and the stresses that we're under, remember I said that stress is cumulative. We are whole human beings. So we may be going from a stressful home situation, a stressful work situation, or a different stressful situations within those scenarios. So you want to help people with being able to lower their stress in those transitions. And things like dissociation, deep breathing, they can really help. Now, dissociation is helpful in being able to kind of take yourself back from the situation, but if it goes too far, then that can also be a problem. So providing some training on dissociation would be helpful in certain situations. Deep breathing, this can be practiced by anybody at any time, and it is so incredibly helpful. The science behind it shows that when we are in a time of stress, we tend to breathe very shallow. And breathing shallow does not allow the oxygen to get to those organs, those critical organs that need it. And that's all part of the fight or flight response. When we can be mindful about deep breathing and send that breath really deep into our lungs, what we're doing is we are sending oxygen down to vital organ systems, which also sends signals to our brain to calm the amygdala down. It brings our blood pressure down. It calms the release of those stress hormones and can help the higher functions start to function well again. So really, after practicing deep breathing, we usually feel a sense of brightness, and we feel a sense of, I can think more clearly. It is scientifically proven that that is a reality. So going through helping people to understand that deep breathing is not a woo-woo thing. It is a scientifically grounded practice that can really help through these stressful events. There's a couple of other processes that I've given you links for. The pause is a medical practice. It takes about 45 seconds to a minute, and it is totally transferable to any type of situation, even outside of the medical field, where you just take a moment to acknowledge the work, to acknowledge the person that you've been trying to help, and to acknowledge the work that you did in trying to help that person. And then low impact debriefing. This is a method that's used by people in the helping professions to debrief in a way that is psychologically healthy for all of the parties involved. So think about it. If you were to come to me and say, you know what, I just went through something really hard, I need to talk to you, and you just start unloading it on me, I may not be in a mental position or a mental state to hear what you have to say at that moment. It could trigger me, it could bring up vicarious trauma for me, it could bring up secondary trauma for me, or I might just not be in a state to be able to help you in that particular time. So going through low impact debriefing can be really helpful. And what this means is that you start with self-awareness, being aware of the stories that you're telling and that they are their own contagion, and that you are able to pass that contagion, that trauma, along to someone else. Giving fair warning to the person, hey, you know what, I've just gone through something, I need to debrief. Then I get the opportunity to ask some questions and figure out Do you just need to vent? Do you need to talk to someone informally? Do you need a scheduled meeting? Asking for consent to determine, can that other person actually help me in this particular moment, or even with that meeting? If I am not able to help you, then it gives me the opportunity to say, you know what, I can't do this right now, or here's where I think that you should go to be able to do that debrief. And then when doing the debriefing, doing limited disclosure, deciding on how much to share, starting with the least traumatic stuff and then working up. And then usually when that happens, you don't have the need to share all the gory details. So it ends up being a better process for everyone who's involved, and it is shown to be very, very effective. Now, the other thing that I want to say about debriefing, because this is something that we should be doing when we're going through these, the pandemic response or any types of emergencies or disasters, but debriefing, when it's not done right, can actually be damaging. Now, debriefing when you have a homogeneous group like first responders, or you have a homogeneous group where everyone is in the same profession and kind of sees the same stuff, that can be really helpful if it's done in a professional setting with a qualified person overseeing the debriefing. When you bring people together who are, in different types of organizations or different types of positions, and you've got one who has seen really traumatic stuff and another who hasn't, that can be really, that can be harmful for people. The other thing is that even in those homogeneous groups, if it's not done well and it's not kind of overseen by someone who has those qualifications to be able to walk them through and identify when somebody might be being triggered, there can be triggering of past traumas that can come up, and you can see ongoing effects from that. And because of stigma, that person might not come forward. So really pay attention to helping people through the stressful events. Couple more to talk about here. Psychological protection. We are seeing an increase in social stigma and xenophobia as we're going through this pandemic. So education about discrimination in the workplace and about xenophobia. Xenophobia is discrimination against people from certain countries or certain ethnicities. And we certainly are seeing an increase in that. So don't wait for people to report that they have been discriminated against or harassed or that they've experienced violence in the workplace. You want to start with education and communication about your policies and procedures for preventing it, for reporting it, and for addressing it, and hold people accountable. So making sure that people know that it will not be tolerated, whether it's between employees, whether it's from members of the public, whether it's from customers. You want to make sure that those policies and procedures are out front and that people are knowing that they're going to be expected to uphold them. A few more: workload management, psychological demands, and balance. So, make sure that you're looking at defining what essential work is and what can be deferred, because you don't want to overload people. Think about, am I able to redistribute or balance the workloads? Are there talents that some people have that aren't being used that could help to ease the load off of some of the people that might be overloaded? Focus on results, not the time spent. As I said earlier, recognize the effort, but expecting people to be able to get the same amount of work done or the same results in a certain period of time when they also have all these other multiple roles that they're having to fulfill could be very difficult. So that may be harder in some sorts of organizations than others where a person has to be there for a certain amount of time, but really try and focus on the results. Define what flexible work is. I've seen a lot of organizations who will say, we have a flexible work policy, but then they don't define what it is. And that uncertainty, again, employees will be asking, well, what do you mean by that? Because if you say that you're providing flexible work, but then still expecting workers to be on the clock during certain hours and nothing really changes, that's not really flexible. And people will have difficulty with exercising their own flexibility when it hasn't been communicated well from management what that actually means. Encourage boundaries and identify what those boundaries are and encourage people to respect those boundaries and provide education about it. Also, encourage people to take their breaks and to use their time off. And you may have to have discussions around, how to use vacation. Certainly during a pandemic, people aren't going to want to use their vacation so much because they can't go anywhere or do the things that they want to do. But it's going to be important to have that rest and rejuvenation and that time to be able to make sure that we're building up our immunity. And also from a business continuity point of view, having everybody come back and then take all of their vacations or think that they're going to take their vacations and then not be able to because you need people to be at work, that could have a negative impact on their mental health as well. So making sure to have those conversations up front as to when people can and should be taking their vacations so that you can make sure that they're taking them, but also have that business continuity is going to help to reduce the uncertainty and any resentment later on. You may have to think about rotating shifts and staggering those time off requests, rotating shifts between people. You may have to have a little bit of extra staff on hand to fill the gaps, certainly if there's any situations where people might need to take some mental health days or some time off to deal with other circumstances. Encourage the use of benefits, encourage the use of those psychological and social supports. And very important, establish a safe space for dialogue. So whether you have a safe space within your workplace, where it's a room that you can go to with an employee to be able to talk with them about what they're experiencing, or it's a virtual safe space, make sure that you have established that safe space to be able to talk about what the challenges and needs are, and that employees know that it's available and how to engage with you for that the use of that safe space. Now, if you have a unionized environment, you have to, of course, include the union in that because the worker may want to have representation with them when they're going into those types of conversations. So keep that in mind as well. And connect workers with the mental health supports, not only for themselves, but for their families as well, because their families are also struggling with this. And if their family is struggling, then that may also impact your worker in the workplace as well. So in conclusion, I'd like you to think about what was the most important thing that you learned from this webinar? And I'd like to put out a call to action. Identify at least one step that you're going to take this week to move forward with integrating mental health into your emergency management and business continuity plans. And the reason that I say to identify one step and do it this week is that the longer we take to start implementing something, the less likely we are to actually do it. So please identify one step and take action this week. And if you need help or you have any questions, I'm happy to answer any questions that you have. I also want to acknowledge that this webinar was developed in a collaboration with Francois Legault, who is a certified mental health first aid and working mind instructor, and he is also the principal consultant for Consult Action, Inc. And Francois has also previously delivered this presentation in French. So if you have any questions in French, then you can contact Francois and he would be happy to answer them. So thank you very much for your time. If you found this webinar helpful, then please let us know and let others know so that they can also access this important information that can help them. Thank you very much. Have a good day. Bye for now.